Hello, my name is João Madureira and I'm a neuroradiologist at Hospital Santa Maria Lisbon and a former fellow at NeuroIBCETR. In this series of videos, we will cover the main topics regarding radial access neurointerventions and how this fits the overall history of ENR. In the first section, we'll review some of the major milestones in interventional neuroradiology and how radial access first appeared. The history of neurovascular imaging has its first steps with Egas Muniz, a well-known Portuguese physician who performed the first brain angiography. Back then, the main goal was to have enough contrast inside the brain arteries to show their anatomical displacement by brain tumors. And the first angiographies were done by surgical exposing the carotid arteries, followed by puncture with large bore needles, a procedure which was too risky and with several complications. We advanced some years to 1947 and we uncovered the first radial access by Stig Hagner, also by direct exposure of the radial artery. Sven Seldinger, some years later, introduced the current percutaneous access technique, which we use in most of the places and allows for a great reduction in the risk at the puncture site. But in the beginning, imaging, endovascular imaging was meant for diagnosis only, which changed radically with Charles Dotter, who pushed the boundaries of medicine and performed the first endovascular radiological procedures, such as balloon angioplasty and stenting. But to perform these treatments in the central nervous system, it was important to have selective catheterism of the vessels, an area in which Perra-Mudson and Melty-Jenkins were really important, particularly by developing catheter curvatures that allow selective catheterism of the major brain and heart vessels. And the concept of curvature is really important for radial access, as we will see in the next sections. The first reference to the femoral sheath, which allowed for even more reduction of the risk at the puncture site, dates back to 1979 by William Berry. And we go some years further, 10 years, to 89, 52 years after the first direct radial access by Stig Hagner, and we find the first coronary angiogram by transradial percutaneous approach by Lucien Campeau. And 11 years later, the first selective diagnostic cerebral angiography report by Matsumoto in 2000. A lot of studies were done in the cardiology field with radial access for coronary procedures, and such as the Matrix trial that you can see in this slide. And this led to the change of the European Society of Cardiology guidelines that recommended radial access as the first line approach for coronary procedures, because it was shown to reduce the all-cause mortality rates, including myocardial infarction, stroke, and bleeding. Although there is some hype regarding radial access in neurointervention, most centers are still proficient with femoral access. Therefore, we should ask ourselves, why bother and go radial for neurointervention? My answer is to keep the history going and develop a route of access that is less invasive, less risky, more resource efficient, and more comfortable for the patient. In the next section, we'll review the main advantages and fears regarding radial access. Thank you for your attention.